Welcome to the Neonatal Intensive Care Unit, or NICU. This is where we look after small premature and sick babies until they are well enough to go home. First, let me show you around. Neonatal units have 4 areas. The main area where you will see most of the machines and babies is called the High Dependency Unit. Here the babies need constant monitoring. Many are on respiratory support or are receiving other treatment. There is a separate room called the isolation room for those with an infection which could be passed around the ward. Here special rules apply, and you should not go inside unless you are working there. As the babies get better or they need less monitoring, they can move to the low risk or step down room. Finally, when they are stable, they can start kangaroo mother care in the kangaroo mother care room. In some hospitals, kangaroo mother care may be started much earlier in the high dependency unit. Because our patients are so small and vulnerable, there are rules which all of us need to follow to keep them safe from infections. Bacteria or viruses which may not harm an adult can be fatal for a premature baby. So make sure you know what the rules are and follow them carefully. Some NICUs will require staff to wear a gown and ward shoes or overshoes which will cover your own footwear. There will be a changing area. Make sure you know where to discard dirty gowns after use. You should dress in your cadre uniform or else use suitable office clothing that is easy to wash. Do not wear jewelry, and make sure hair is carefully tied out of the way. Infection prevention means stopping germs from being passed from baby to baby or from staff and carers to babies. Hand washing is the most important measure for this. There are several hand washing basins with soap. Please use them. There are alcohol gel containers as well. You must wash hands or use the gel every time you move from one cot or baby to another. Use gloves whenever you do an invasive procedure or when you handle a baby, especially if they are premature or sick. If you are looking after a baby in the isolation room, you may need extra personal protective equipment or PPE, such as a gown and mask, depending on the type of infection. There is often a special bin outside the room to discard these immediately afterwards. Make sure you are familiar with the other bins. Any clinical waste, such as used cannulas or dressings, go in the bin marked clinical waste. General waste bins are for all non-clinical or non-infectious waste. Sharps containers are for needles, scalpels, glass vials, and other potentially dangerous items. Mobile phones are another real source of infection. They need to be disinfected by wiping them with alcohol frequently during the day. Only use them for essential work-related matters. There is often a dedicated area for charging them. Don't use the sockets intended for medical equipment. Make sure you also disinfect the charger and the cord after use. There are a lot of different medical devices in use on the ward. Some of these, like radiant warmers, oxygen concentrators, and CPAP, are plugged into the wall and so cannot be moved easily. Others, like the pulse oximeters for reading oxygen saturations or the hemoglobinometers, are portable and can be taken from baby to baby. All of these machines represent a high risk for cross-infection if they are not cleaned after each use, usually by rubbing them with 70% alcohol solution. None of the devices should ever be placed inside a cot. There may be devices that you are not familiar with. During your time here, we will show you when and how to use them and clean them. We will supervise you until you are comfortable to use them on your own. There are also videos, training modules, and job aids that you can have access to, showing you how to use all the various devices. So do not be afraid to ask. It is also a good idea to make friends with the biotechnicians when they visit the ward, who will help with any queries. Finally, there are rules around visiting, again for infection prevention. If whole families turn up, they will not be able to enter. In some areas, like in the KMC ward, mothers are there the whole time, and a close relative can usually visit at any time. But in the high dependency area, there may be more restrictions. Make sure you know the ward protocol about visiting. There is a doctor or clinical officer in charge of the neonatal department who coordinates clinical protocols, the ward round program, and other day-to-day activities. This person also represents the unit in hospital management meetings. The nurse in charge is responsible for all nursing activities. He or she orders new consumable equipment and reports broken or malfunctioning equipment. They supervise the nursing rota, cleaning, and other nursing activities. The nurse in charge also allocates meal times and breaks, depending on how busy it is, to make sure that the ward is not depleted of staff all at once. Usually meals and tea are taken in the staff room. Eating is not allowed on the ward. Likewise, all holiday requests from nursing staff go to the nurse in charge, and from medical staff go to the doctor in charge. Students will have holidays set by their institutions, but should let the sister in charge know when they will be away. When you first arrive, it is important that you introduce yourself to the sister in charge, especially if you are a visitor or student, and explain why you are here. If you are sick and cannot be on duty, you must inform the sister in charge as soon as possible. Find out from them how many days you can be absent before you need to get a sick note from a doctor. If you have an infection like a cold or flu, but still feel able to work, then you should also tell the sister in charge, who will decide whether it is sensible for you to come into work or stay away to prevent cross-infection. Hospitals have different rules about sick notes, so find out what these are. Drugs are kept in 3 different places. Dangerous drugs are in the locked DDA cupboard. The most senior nurse has the key and will check the prescription for the drug requested and dose. Some medicines, especially injectables, are kept in the fridge. Other frequently used medicines are in the drug cupboard. You should ask the sister what to do with half-used vials of medicines. You can also ask how to dilute medicines, draw up the correct dose, and give the medicines. Doses are often very small, so have to be measured carefully. If you are new to the ward, you will usually be attached to a more experienced staff member to learn the routines in the different sections of the unit. You may also be paired up with a buddy who can answer questions and be a friendly mentor. There is often a handover meeting first thing every morning, where nurses on night duty hand over to the day shift. They may take the day staff to see babies who have been worrying them during the night, as well as any new admissions. In many units, 2 nurses do a regular drug round to check dosing, patient names and drug names, and then document what they have done. The doctors do a ward round every day, usually in the morning. There should be a doctor available all day. Often there will be another round in the afternoon to see any new admissions. Ideally, a senior nurse will accompany them. Teaching ward rounds are arranged at times that are least disruptive to the smooth running of the ward. Nurses typically do vital sign monitoring every 1 to 4 hours in the high dependency area, 4 hourly in the low risk area, and twice a day in the KMC area. Although times may vary in different units and very sick babies may need more frequent monitoring. You will find patient notes next to each cot or patient. These notes are confidential. You are welcome to look at notes of infants that you are caring for or you are called to review, but the information must stay with you and the team caring for the baby. Do not gossip about your patients, especially if they could be identified by neighbors or friends from what you say. Do not take notes off the ward and do not take them home. You can only film or photograph on the ward with the consent of the sister in charge. And if a mother is involved, she must also give consent. In some places, permission will also be needed from the hospital director. If you need to get a lab test done, lab request forms are kept in a folder in the nursing office. You need to fill out these forms completely and carefully. State if the test is urgent or not. Make sure you use the correct sample bottle and that you know what the sample size should be. Label the bottle legibly and carefully. Then keep the form and the bottle together, using a clear plastic sample bag if available. Find out where samples are gathered to be collected. Usually blood tests are done early in the morning, so that results can come back as quickly as possible. There is a similar form to order an X-ray. Give some clinical background to help guide the radiologist. In some units, urgent X-rays can be portable at the bedside, but need to be requested as such. Any baby going to the X-ray department must be accompanied by a nurse who should take resuscitation equipment to deal with any emergency. Doctors can complete referral forms. Because there are a lot of different people who visit and work in the unit, the notice board is an important place for general messages about meetings, rotas, and other reminders. You can also find important phone numbers and what to do if there is a fire. Some hospitals have fire alarms. If you hear one, check whether it is a practice or a real emergency. In an emergency, patient and parent safety is the top priority. There is a standard of practice or SOP of what to do in different emergencies, which is kept in a folder on the ward. Ask the sister in charge to see it and make sure you are familiar with it. This is just a quick summary. There will be lots of other things that you will need to learn about the ward. If you are new, don't be afraid to ask a more experienced team member if you are unsure about something.